All right, well, thank you everybody for hanging on until almost the last. I really appreciate your attention. Yes, my name is Megan McCarroll. I did get married over the course of this program, so I did have a name change. I'm a registered midwife and I work in Ontario, and that's where I live as well. So I'm gonna get started on my presentation here, but I do of course, want to acknowledge the territory on which we stand. I would like to acknowledge with respect and gratitude that I am a visitor to this territory, and I would just like to also thank everybody for sharing this space with me today. Okay, so let's get started on the culminating report presentation. I'm going to try and keep it light and breezy. I know that this is the end of the day, but if you do have any questions, please save them for the end. Hopefully, if I can get through my material, then we'll have lots of time to discuss. So I'm going to just give you an overview here. My introduction to the Oracle program is where we're going to get started. I'm going to talk a little bit about a literature review, go through some program evaluation basics, talk a little bit about my program evaluation proposal, which was my project at the end of my practicum, and then, as I said before, hopefully open up for a little bit of discussion. So I'm going to get started with this introduction to Oracle. So Oracle is the Ottawa Outreach Perinatal Care Program. It looks like it's an acronym, but it's a little bit of a convoluted acronym. So what it is a multidisciplinary care pathway for pregnant persons with substance use disorders. And what I mean in terms of perinatal care is, of course, in and around the time of pregnancy, birth, and the postpartum period. It's important to understand that Oracle is where I did my practicum, but the focus of my project was in program evaluation. That's going to become a little bit more clear as we get through. So Oracle employs a harm reduction model to address certain issues that arise in this population. It comprises outreach midwifery, high-risk obstetrical care, social work, allied healthcare professionals, Children's Aid Society case managers, and a variety of other associated professionals. And it's located in the city of Ottawa. Okay. So the public health issues that I touched on earlier, I'm just going to go through them briefly here. So we're looking at substance use disorders, opioid use disorders, mental health disorders, and then some of the social determinants of health, so poverty, food insecurity, employment insecurity, and housing insecurity. And the important thing to recognize is that we're looking at really big picture public health issues, very complex health issues, as they intersect at a particular time in the life course, which is to say in and around the time of pregnancy. So the program Oracle is looking to address these numerous public health issues within a population that typically does have higher health care needs and is often excluded from the majority of public health and primary health care. Okay, so why did I do a literature review? Well, full disclosure, I did not know anything about substance use disorders or opioid use disorders in pregnancy when I embarked on this practicum many moons ago. So for me, it was really important to get a sense of what I was looking at. Full disclosure, I come from a science background as a registered midwife. Yes, we have this element of social justice, but my experience in research was very much quantitative. And so I thought it was important to get a good sense of what I was diving into before I walked in without any exposure to some of the literature. So I did go through about 135 articles. I did a keyword search in the last 20 years, or just under the last 20 years. I looked through Google Scholar and the University of Victoria Summon. I was very fortunate to have some help from the public health librarian, thank goodness. And so that gave me the opportunity to take a look at a lot of research. I did have to exclude a fair amount of information that was based on those quantitative measures of program success, things like neonatal abstinence syndrome, decreases in perinatal poor outcomes, preterm labor, et cetera. And I really had to sort of hone in on this one specific area, which is multidisciplinary care pathways in providing perinatal care to this type of population. So just as an idea, just as an explanation for what I was looking at with my literature review, which I did in the first half of the course. So 3 key themes emerged for me through this literature literature review. The first one is that, shockingly, not shockingly, the multidisciplinary care pathway is considered to be an evolving best practice in taking care of individuals who are within this population at this time in their life. And by multidisciplinary, I don't just mean a million different healthcare providers. I'm not just looking at, the clinician in your methadone clinic, your family doctor, and your obstetrician. I'm looking at a whole tapestry of different professionals who are going to be involved, that are integrated together, community-based, and involve primary care leading up to, during, and beyond this period of time. Oh boy, I gotta speed up. Okay, so that was the first theme. The second theme is that we need to have programming that is trauma-informed, culturally safe, and family-centered. I think that this goes without saying within our group here, but beyond a public health and social justice group, that might be fairly revolutionary. So, we have to make sure that we recognize how important that is. And then the third major theme that arose from through this literature review was that it's actually really hard to do research with this population of individuals. They are typically excluded from a variety of developmental stages that go into making these programs. And so if the engagement is not happening with the individuals who are hopefully being served by the program, it's really not going to be effective. So let's move on. So program evaluation basics. I know we've talked a little bit about program evaluation today, but there are really important aspects of program evaluation. Oracle on paper appears to be meeting the goals of the literature review that I was just describing, but how can this really be evaluated? How can you quantify or qualify whether or not a program is actually meeting its aims? And enter the program evaluation. So the basics of the program evaluation is that it's a systematic, methodological, and empirical way to take a look at the various resources available and the various goals of a certain program, and look at different opportunities that can be accessed by doing an evaluation. So we're looking at program functioning, we're looking at funding opportunities, everything in that realm. There's obviously some downsides to a good program evaluation. The weaknesses include time. It takes a really long time to do it. It's expensive. A lot of people aren't really thrilled about the idea of airing their dirty laundry, so they're concerned about failure exposure. There is this concern that if there isn't a wealth of data to indicate what is the best practice, how are we going to know without somebody coming down hard on us following our evaluation that we're doing the right or wrong thing? And there's a lot of fear wrapped around that. So, the other issue is that you could evaluate one program and it could just be helpful to that program, but couldn't necessarily be repeatable in different communities. So people sometimes think, what's the point? So the threats, obviously, are stakeholder disengagement, both from the people who are running the program and from the community members who are engaged in the program. There is some concern, obviously, in trying to get an evaluation off the ground that people aren't just gonna want to participate. And so, as I said before, there's also that fear of failure exposure. Okay, so within the program evaluation proposal that I developed for Oracle, I looked at engaging stakeholders, different methods to get people excited and really interested in the idea of doing the evaluation. I sort of sold them on it by helping them establish their program goals and really solidify the indicators of success. Further, I developed an evaluation framework and chose a research methodology. What I looked at was a mixed methods approach to try and answer that one critical question, which is, are we doing what we wanted to do? Are we meeting the goals that we set forward? And how are we going to make sure that we're accountable to our different stakeholders? Within that methodology, proposed several data gathering methods, and then again proposed an evaluation timeline. Okay, so I know that we've seen this graphic already. It's pretty popular from the CDC, but the question is, where does the proposal fit in? And my answer to you would be anywhere. I know, it's a dry subject that I'm super excited about, but the reason is it's a really important way to just continue the evolution of a program, to make sure that the goals are being met, to make sure that people are really taking ownership and taking on these leadership roles, and that they're doing what they set out to do. Our time is really precious. It's really important that we're doing the work that we set out to do to remain passionate and engaged. And this is a a really great way to do that within a program, especially one like Oracle where they have such an important mandate. So that is incredibly it. I just want to end with my, my big theme here, everybody, is, what is health improvement for a population like this? What are the indicators of success? How does that expose our value judgments about what is good and what is bad and what is helpful in terms of improving health? And, it's really, the program evaluation is a great way to engage everybody involved so that everybody's voices are heard. I'd just like to very quickly acknowledge the wonderful people who helped me get through this program, especially Nigel, who got me through such a challenging time. Natalie, who was my second reader, Summer O'Neill, who was my practicum advisor, and the Oracle program facilitators, my friend Maren here, who was my tireless editor, and most of all, these little stinkers who were not even conceived when I started this program. So if that gives you any indication of how long it took me to get here and how excited I am to finally be here, that is the answer. Thank you.
Well, Megan, given your energy and your enthusiasm, you can evaluate any of my research programs anytime.
Oh, I'm ready. Let's do it.
Even if the outcomes are bad.
Okay.
All right. Any questions?
Oh, come on. Thank you. But make it an easy one. They're watching.
Do you have twins?
I have twins. Yeah. Yeah, so fair enough, yes. That is Silva and Marin. They are 2 minutes apart, and then my son Bear was born about 2 years after that. I know.
How do you find, I guess, mitigating the concerns of groups that are experiencing an evaluation and that fear that comes about with this kind of like authoritative person coming in saying like, hey, what are you doing, and are you doing it well?
Yeah,
like, how do you mitigate that?
Just blind brute force, basically. No, I'm just kidding. I know that we kind of rip through it fairly quickly, but no, it's the biggest issue. Trying to communicate the importance and the value of the evaluation proposal and a program evaluation was above and beyond, far and away the most challenging aspect, certainly of my project, and I can only imagine, this was a purely academic exercise, I can only imagine how challenging it is. My advice is generally, and this is a direct rip from Natalie Franson, is to embed the evaluation component into the program as it's being developed before it even hits the runway. If that doesn't happen, it can be really hard to narrow down the goals and to really sort of hone in on what those indicators of success are and how to measure them. And so to kind of take a step back and go all the way back to the beginning and say, guys, what were you really trying to do here? Were you trying to decrease the number of preterm births, or were you trying to decrease the rate of CAS apprehensions? Is health improvement abstinence from all substances, or is health improvement just, limiting certain poor outcomes? And getting people to the table to really work through that. It's really, really hard. People's time, as I said, is very valuable, and while it is a useful, it's a good way to use their time to sit down, get through an evaluation, and really learn from the things that they're doing really well, and some of the things that they are almost doing really well but could do even better. I think that we have it in our minds to just focus on the negative, and that component is really, really tough. I find enthusiasm really helps. I don't know if you've noticed. And I would say that by the end of the project, my supervisors seemed to be, a little bit more easy about the idea, seemed to be more on board with the plan, and wanted to perhaps take it from an academic to a real life exercise. So that was a huge, huge success for me. But yeah, it's really hard. It's really hard.
Excellent, very good answer.
Thanks.
Good. Well, thank you again for
Thanks.
a wonderful presentation. So how do you